Good afternoon and welcome to the 2020 Komen, Florida Komen Grants Portal Applicant Training. The way that our grants work, we are in a fiscal year. The dates that we'll go over of the program, and we'll get started. For today's webinar, everyone is muted. If you have any questions, you can ask them in the chat box. We certainly encourage resource sharing and getting to learn who is participating in this training, and we'll get started. For today's agenda, we're going to go a little bit of the background of Susan G. Komen, overview of the community grants process, specifically what our funding priorities are and how they ties to the community profile, what the requests for applications look like, and most importantly, our grants portal. This is new to everyone this year. We are on a new system. It's new for us at Komen ourselves, so we'll be learning together, but there is a plethora of resource and help manuals available for you. So a little information about Susan G. Komen. We are the world's leading nonprofit breast cancer organization. We have an unmatched, comprehensive 360-degree approach to fighting this disease, and we advocate for patients' drive, research breakthroughs, improve access to high-quality care, offer direct patient support, and empower people with trustworthy information. Most importantly, and what we really relate everything to when it comes to our grant making, is our bold goal. And the bold goal is to reduce the current number of breast cancer deaths in the US by 50% by 2026. And we're making a lot of strides to reach this bold goal. When it comes to awarding the grant, our blind grant review panel, and we'll go a little more into the review panel later, base everything upon this bold goal. So keep that in mind as you're developing your project and how that connects with the bold goal. So the aim of our community grants, as we said, is to reduce breast cancer mortality by addressing disparities, increasing access to quality and timely care, and improve outcomes through patient navigation. So those are the three main buckets, really, what we're looking to accomplish with this. And a little bit about the process itself. The community grants process is rooted in the community profile. Every 5 years, the affiliate conducts an in-depth look at the breast health needs in our service area. So this community profile, it happens in every affiliate across the country, as well as looking at statewide. So our next community profile, and we'll share a little bit how you can access that community profile, was last conducted in 2015. So on our website, you are able to access that information. And let's just show you here. So on our website, if you come up underneath Community Impact, you'll see Funding Priorities. And under Funding Priorities is our Community Profile Report. I highly encourage you to familiarize yourself with this report because this is what ties back into the RFA. More so, to access more information about the grant itself and how to access everything, on our homepage as well, underneath Community Impact, you'll see, you'll see how to apply for funding. And underneath Community Grant Programs is where you can access the portal itself, a copy of the RFA. And what's nice is the RFA is located within the grants portal itself. Perfect. So these funding priorities from the community file are the basis of the RFA, the request for applications. And us as the affiliate works to identify potential eligible applicants, which are y'all today on the call. Part of the solicitation process is the training that you are participating in today. Our goal is to have a wide range of high quality program applicants to present to the review panel. This enables us to have confidence in the programs selected for funding and are in fact the most impactful. In order to help the applicants develop the proposals that will meet the needs in our community, that's one of the main reasons why we're hosting this workshop. I would rather you spend time between now and December 13th, which is the deadline, and we'll go over that in a moment. Please reach out to me, and my contact information is at the end. There is plenty of information on how to complete the RFA. There is plenty of information in the portal itself on how to work your way through it. It is quite intuitive as opposed to the past systems that we've used, but we want you to put together a complete and thorough application. These applications are then reviewed by an independent review panel comprised of experts and representatives from the community The review panel develops a grant slate that is then presented to our board of directors for formal approval. And then us as the affiliate will award grants for the next fiscal year, which, as I said, our fiscal year begins April 1st through March 31st. And then begins a process of active management and monitoring each of our grantees' progress toward these objectives. So important dates to remember is first our deadline of December 13th. This is a hard deadline at 11:59 p.m. So beyond that, unfortunately, we are not able to accept applications, but you have a good 6 weeks or so to work on this and get everything in. As I've said before, I strongly, highly encourage you to reach out to us if you have any questions relating to your proposal for the project. Our review panel will be formed and review in January 2020. A little bit more background on this review panel. No Komen staff sit on this. I help moderate and manage this. I provide information and background, but I'm a fly on the wall. I will sit there and answer their questions, but we have no input on the decisions by this review panel. Once our review panel sets a grant slate, is then provided to our board of directors for a vote at our February board meeting. And then on March 1st, our notifications will go out to our grantees, as well as notifications to those that were not selected this year, but will be encouraged to apply in future years. At that point, once the contract is signed, the execution will be commenced and the first payment will be sent. The grants are dispersed in 2 payments, one upon completion of the contract and one after the 6-month progress report, which is due in November of next year. Our site visits, we try to schedule for November of 2020. October is a little too busy for us, as you can imagine, as it is being Breast Cancer Awareness Month. And we'd like to have our grantees complete that progress report so we can compare it along with that site visit. We also have a site visit worksheet that you will complete that helps us make sure that everyone is on task when we have that site visit. The final report is due 30 days after the completion. That should say April 30th, 2020. I'll have to update that. And that is when the completion will be for this grant. So our community profile is what, the why, and the how. So it's really an assessment of breast cancer and breast health services to ensure effective and targeted efforts with rigorous collection and analysis of data. This is done, as I said, on a statewide level, but it's also broken down county by county so we can identify those areas of highest need. So the 3 areas of our funding and priorities based upon the community profile are patient navigation, reducing barriers to care, and breast cancer education with follow-up. We strongly encourage you to have these be the focus of your projects. Anything otherwise will not be considered. So evidence-based practices are really the key for your project. We don't want you to have gut instinct based upon it. You really should be basing your project on evidence-based practices. These have been shown through scientific research to consistently improve measurable outcomes. And that's really what we need to be able to see to be able to manage the metrics of these projects. So the eligibility requirements, unfortunately, individuals are not able to apply. You have to be a 501c3 organization or a governmental organization with the 170C1 status. Now, with our expansion statewide, you are able to apply for a grant from 64 of 67 counties. The only counties that we are not serving are Broward, Miami-Dade, and Monroe. And there's another affiliate in the Broward, Miami-Dade that handles that and has their own grant-making activities. So everything today must fall within the other remaining 64 of 67 counties. So allowable expenses, these are the areas, and once again, all this information is available in the RFA, which is through the portal and on our website. So they are key personnel salaries, consultant subcontractors, supplies, travel, patient care, other direct costs, and equipment including software. So 2 things to note: this travel isn't for necessarily going to conferences. These travel has to be directly related to the project themselves, as well as the software and hardware has to be directly related to the project. This year, the caps for the projects for patient navigation are at 80,000, and for navigation education is 28,000. So funding restrictions, these are areas that we will not fund. They are research, education regarding breast self-exams and use of breast models, the development of education materials. Komen itself has a wide range of library of materials that we certainly encourage you to use when developing your project. Also, we will not fund education, health fairs, any sort of activities like that, and then indirect costs related to your project. So, important grant policies. The project must occur between April 1st, 2020 to March 31st, 2021. Expenses may not be accrued against this grant until the contract agreement is fully executed. Sometimes this contract can take up to 6 weeks. We certainly hope that process moves smoother, but we cannot backdate any payments based upon that grant. So anything retroactively will not be accrued. It has to be specifically from the execution of that contract. Insurance requirements. Every grantee must carry a certificate of insurance with a minimum of $1 million in commercial general liability. That's pretty straightforward. As we said, we will not fund projects with education materials. You can access our education materials on Komen's website, as well as you can reach out to me and we can help you develop those if there's something else you're looking to do. But specifically, we will not fund education projects that are teaching or endorsing the use of monthly breast self-exams or use of breast models. All proposals must be submitted online through our Komen grant portal. As I said before, the deadline to submit is December 13th, 2019 at 11:59 p.m. So this is going to look new for everyone. This is what the Komen grant portal will look like. You can access that by going to komen.smartsimple.com and you will click the register here button. Now, with something new this year, there's only one type of user role in the platform. Now, with that, that means that we do not need the authorized signer to register for the portal. There needs to be an authorized signer associated with the project, but they do not need to actually push the buttons inside the portal, which is nice. You will have to have this authorized signer complete a form that will have to be uploaded into the platform, but they do not need themselves to participate. So the eligibility quiz, before you can complete the registration process and apply, you're gonna have to answer the following eligibility questions when prompted. Is the applicant a government, tribal, or nonprofit organization? Will the project address breast health and or breast cancer? Will the applicant propose funding for any non-allowable cost? If the applicant is a governmental or tribal organization, complete the organizational information page and click Submit button to create a profile in the system. If the applicant is a nonprofit organization, complete the organization service page to find the applicant organization in the IRS database and click the search button. Once the application organization is located, click the organization name displayed to show the organization information page. Complete the organization information page and click the submit button to create a profile in the system. Once the registration process is complete, the message below will be displayed after your password is set and you can log in to begin an application for funding. So this is what that registration organization search page looks like. The easiest way to search is by your EIN. Sometimes your name that you go by, as a DBA might show up differently, but these are tied to the organization searching with the Internal Revenue Service database. So like I said, EIN is the easiest way to search. You can use multiple fields, but I would recommend searching by EIN. Upon completion, this is what you will see. What's nice is that there is no need for a Komen staff member to approve the registrant. Once you are logged in, and the system will automatically get you logged in and approved. Once you're in, you're going to click on Funding Opportunities, which will bring you to our Community Grants Program. So this is the grant opportunity that you can apply to, and you'll click on Apply Now. So I highly encourage you to save and save often. The system will log you out after 30 minutes. So you might want to, in addition to working in the system, have a Word document open with your proposal and constantly be referring back to that and saving from there. That way it's all consistent and you don't have to worry about the system logging you out. So with the project information tab, so everything is really consistent in here. You're going to complete all the required fields. You're going to list your project partners by clicking Edit Project Partners, and we certainly do encourage collaboration with your projects. That's something that in years past, I know that the review panel likes to look favorably upon. You're going to you're going to upload all the supporting documents and then click Save Draft. Remember, save and save often. With the project objectives, it all ties back to SMART objectives. So giving you an example of a SMART objective is something that's measurable, that has a time frame around about that's actionable. So here are two good examples of SMART objectives. So when you're completing your project objectives, tie them to SMART objectives. With your project information, you're going to have edit your project partners, as I said, and this is where you'll be attaching the project partner documentation. Your project narrative. So the statement of need describes the need for the project and explains the target population, including age, race, ethnicity, geographic location to be served using demographic and breast cancer mortality statistics. Explain how project objectives will address the stated funding priorities. The project design. Describe what will be accomplished with the project funding and the strategy to reduce breast cancer mortality and increase the percentage of people who enter, stay in, or progress through the continuum of care. Explain how the project incorporates evidence-based practices, providing citations for all references. Explain how the requested budget and budget justification support the project objectives. Explain how project staff are best suited to accomplish project objectives. Partners in obtaining the project. In this section, you're going to explain how collaboration strengthens the project. As I said before, the review panel strongly likes to see collaboration amongst partners in your community. So keep that in mind as you're developing your project and your narrative. Describe past accomplishments with breast cancer projects that address our funding priorities. If the proposed project is new, describe success with other breast cancer projects. Describe the resources to be used to implement the project. Impact and evaluation. Describe how the project objectives will reduce breast cancer mortality by addressing disparities, increasing access to quality and timely care, and are improving outcomes through patient navigation. Describe how specific project objective outcomes will be evaluated. Describe the resources and expertise that will be used for monitoring and evaluation during the performance period. And this is all going to come underneath the narrative tab. As I said before, save and save often. So in the RFA, once again, you're going to refer to the RFA guidelines. And then with your project information, you'll have that narrative tab where you will complete everything. Remember to edit your SMART objectives, and this is where you're going to add them in. You're going to click the plus sign to add your specific, measurable, attainable, realistic, time-bound objectives and choose a relative service type. So the service type will determine the data reports applicable on progress and final reports if the application is selected for funding. So you're going to take time to review the reporting metrics listed in the RFA. There are 7 possible customized report pages in each progress report and final report. They're education and training, screening services, diagnostic services, treatment services, treatment support services, barrier reduction assistance services, and care coordination, patient navigation, and case management. Note, if awarded, you will only see report pages that correspond to the services selected in the application. On the Demographics tab, select the targeted demographics and locations from the displayed list to be addressed as part of proposed projects. Click Save Draft when complete. As I said before, save early and save often. The worst thing you could have is to have the system log you out and not have your information saved. On the budget tab, you're going to complete all required fields after reading the allowable cost section of the RFA. This will include editing key personnel salaries to add Komen-funded staff that directly contribute to the achievement of proposed project objectives. The project director must be listed with a copy of their resume, whether they are Komen-funded or not. The patient care section will allow applicants to enter the type, number, and cost of services to be provided. Percentage of project activity button is used to assign a percentage of proposed Komen-funded project activity between either education, screening, or diagnosis and treatment. There are supporting documents that you must have, and they are the proof of tax exempt status, your letters of support or memorandum of understanding from your project partners, and then the resume or job descriptions of your budget in your key personnel. And so these are the different sections within the grant portal where you have to upload them. Now, as I said before, you do not need to have your authorized signer participate in the completion of the project. They will just have to sign the authorized signer form, and then you will upload that upon submission of your project. So the way that our review panel looks at this is they go over statement of need, project design, partners in sustaining the project, and impact evaluation, and this is 25% for each. So statement of need looks at how well the applicant identified the need for the project and explained the target population to be served. To what extent does the project objectives address the stated funding priorities? Project design. How successful was the applicant at describing the strategy to reduce breast cancer mortality? How well has the applicant described what will be accomplished with project funding? To what extent does the project include evidence-based practices? How well does the project budget and budget justification support objectives? To what extent does project staff have the expertise to effectively implement and provide fiscal oversight of the project? How well does the applicant explain the roles, responsibilities, and qualification of project partners? How well has the applicant demonstrated evidence of success in delivering services consistent with stated funding priorities? How well has the applicant described the resources to implement the project? Does the applicant have the capacity to manage a project? And finally, under impact and evaluation. To what extent do project objectives reduce breast cancer mortality by addressing disparities, increasing access to quality and timely care, and/or improving outcomes through patient navigation? To what extent does the evaluation plan aim to collect the relevant required metrics? To what extent are the applicant's monitoring and evaluation resources likely to adequately evaluate project success? And here is the way that our review panel scores it based upon a score of 1 to 7. As you can see, minor weaknesses are easily addressable and do not sustainably diminish the ability to meet the review criteria. Moderate weaknesses diminish the ability to meet the review criteria, and major weaknesses severely limit the ability to meet the review criteria. As I said, the review process begins with a compliance review by staff from our affiliate, and we will ensure that the applications adhere to the RFA requirements. If that application meets compliance review, then it is passed along to the review panel. This review panel is from experts statewide that are representing various different ethnicities and cultural groups, as well as professions and life experiences. So we will have survivors, we will have medical professionals, we'll have experts that serve on this review panel to help review these grants. A minimum of 3 review panel members will score each application. Then we have a review panel meeting that discusses the grant applications, and then we are scoring it based upon that 1 to 7 format. Not everyone, unfortunately, is able to be funded. We would love to provide funding for every grant application, but we are limited on that. This year, we have not set that final amount, but we're looking at in excess of about $250,000 based upon last year and what we will be making in grants for fiscal year 2020. Once the review panel sets that grant slate, it is then passed to the board of directors for approval. So some helpful hints: use the grants portal manual and follow directions as written. So what's really nice is that within the panel, the portal itself, there is a help button. Click it, because within there you have the applicant user guide and then a training manual. So everything that you really need to know is available within here, as well as available on our website. And then this webinar today will also be available on our website. As I said before, save early and save often. What's also nice is you only need to have one user in the system to manage everything, and that the authorized center doesn't have to be within the system as in years past. They're not required to start any of the progress reports or initiate an application. If you have any questions throughout the process between now and December 13th, I highly, highly encourage you to reach out to me. Please give me a call, send me an email. I do my best to get back to you in a quick and timely manner, but as you can imagine, as a statewide organization, we are limited on staff and quite busy, but we do our best because I want to ensure that every applicant that submits an application is going to meet compliance review, as well as have a complete application to provide to our grants panel. So at this time, I'm going to open it up to any questions that you may have. You can put them into the chat box, and we will stay on for a few more minutes. Does anyone have any questions? Liz has a question. Did you mean at this time there is a $250,000 for the award? The total amount that we will be granting in all of our grants is going to be around $250,000. Usually our grant making is between $250,000 and $300,000 total that we allocate. We also invest in something called the Treatment Assistance Fund. This is something, whether you are a Komen grantee or not, we strongly encourage you to provide information to your clients. The Treatment Assistance Fund is something that we invested in last year. We made a $60,000 investment, and what it allows is a client who is 200% below the poverty level is able to call a 1-800 number to call Komen headquarters, and based upon qualifying, they can receive a one-time financial stipend of $300, as well as some psychosocial counseling and additional support. Terry has a question. This opportunity would potentially provide funding for screening mammograms for underinsured women. Yes, this is a perfect example of a project that would fall within our funding priorities. As I said, I would highly encourage you to review the community impact profile, as well as reviewing the RFA, which are both available on our website. Does anyone else have any questions? Linda, I tried registering yesterday, but an error came up even though everything was completed. Linda, if you would connect with me offline, we can walk through and see what issues you are having. Please send me an email at josh@komenflorida.org. If a county, Terry has a question. If a county is not listed as a high priority, can we still include it in our request? Absolutely. We certainly encourage applications and projects to cover 64 of those 67 counties, but based upon our community profile, there are areas that are indicated as higher priority than others based upon various factors. Are there any other questions? All right. Well, thank you so much, everyone, for joining us today. We certainly appreciate your time. If you have any questions, please feel free to reach out to me at, oh, sorry, Carolyn has another question. Carolyn, in the application for treatment, it requires that numbers and costs be separated out into how many receive chemo, radiation, etc. Breast cancer patients, treatment in combination. How do we address that? Carolyn, let's talk offline and I will answer your question as best as possible. so I can make sure get you the most specific information that you need. All right. And